Good morning, good afternoon, good evening, everyone, again, wherever you're joining us from. I'm hearing an echo, so if others could please mute your mics, that would be really great. Thank you, and a warm welcome to everyone. As we get started and as people are coming in, I would encourage you to please drop a quick introduction in the chat and tell us where you're joining us from. So use the chat to just let us know who you are, where you're joining us from. My name is Martha Melez, and I'm a Senior Program Specialist at Canada's International Development Research Centre, or IDRC. I'm joining you from the IDRC's head office in Ottawa, Canada, which is situated on the traditional and the unceded territory of the Algonquin and Anishinaabe people. I would also like to recognize that you're joining us today from many places and acknowledge the traditional owners and caretakers of those lands. I have the great pleasure of moderating today's webinar. The webinar is organized by the Donor Committee on Enterprise Development, or DCED. For those that are not familiar with it, DCED is a global platform that brings together donors, foundations, UN agencies, and other development actors to learn about what works in creating more inclusive and resilient economic opportunities, and particularly through market systems and enterprise development. Today's webinar is part of the work of the DCED's Women's Economic Empowerment Working Group, which my organization is a part of. As the title of the webinar indicates, today's sessions bring together two issues that are deeply connected but not always discussed together: climate change and the care crisis. Climate change is something we are all hearing about and increasingly experiencing in our own daily lives. Rising temperatures, floods, and more frequent and intense extreme weather events have made this an urgent global priority. When we talk about care, we're referring to the essential daily labor that keeps our households, communities, and economies functioning. So this includes raising children, caring for older persons or those who are ill, supporting persons with disability, or even everyday tasks that sustain life, such as cooking, the cleaning, and in many contexts, collecting water or fuel. This has also been an issue that has gained more visibility during the COVID-19 pandemic. So what's becoming increasingly clear is that these two issues are closely connected. And there is a growing body of research, including work supported by the IDRC, UN Women, and others, showing how climate change and care responsibilities interact and often reinforce each other. So today, we are going to unpack that connection. And in particular, we look at how it affects women's economic participation, the resilience of their businesses, and the ability to adapt to climate changes. The discussion would draw on a report commissioned by the DCED, which looks at these issues in the context of women-led micro, small, and medium enterprises. We are very fortunate to have with us the lead author of the report, Kate Grantham. Kate is a feminist researcher, consultant, and associate with Core Global. The report, which is titled Care as Climate Infrastructure, Strengthening Climate Resilient Private Sector Development for Women-led MSMEs, will be published at the end of this month. And today we are going to get a sneak preview of its key insights from Kate. And to help us ground this in practice, we are also joined by two esteemed panelists. Joining us from Ahmedabad, India is Neha Abraham, sitting in over 40-degree weather and experiencing heat wave firsthand. Neha is the lead of partnerships and advocacy at the Sewa Cooperative Federation. For those who may not be familiar, the Sewa Cooperative Federation is part of the broader Sewa movement, which brings together 3.8 million women workers in India's informal economy. The federation supports collective enterprises owned and managed by women workers, helping them build stronger, more profitable, and more resilient businesses across sectors like agriculture, dairy, handicrafts, and finance. We are also joined by Richard Waindi from Nairobi, Kenya. Richard is the founder and executive director of AgWatch Africa Foundation. AgWatch is a social enterprise working to expand access to high quality, affordable elder care services while also creating livelihood opportunities for young people in local communities. With that, I am really looking forward to the discussion and to learning from all our speakers. We will start by hearing from Kate and then move into a moderated discussion with our panelists, and we'll have time for the Q&A at the end. But before I hand over to Kate, just a few housekeeping points. I'd like to, if you would like to ask a question, please use the Q&A box at the bottom of your screen, not the chat. If you don't see it, you have to click more and you'll find it there. So we'll take these questions during the Q&A session at the end of the panel, and we'll be monitoring that. And I will encourage you to drop your questions as they come along. The webinar is being recorded, and we'll share the recording and the slides with all the registered participants in a few days. And we'll be sharing useful links throughout the session and resources. And we'll encourage you to do the same from your end. With that, I will hand it over to Kate. Kate, the floor is yours.
Thank you so much, Martha. I really am so delighted to be here today to share some highlights from our forthcoming report, Care as Climate Infrastructure, Strengthening Climate Resilient and Inclusive Private Sector Development for Women-led MSMEs. So today, my plan is to just briefly introduce the research, share some of the key findings from the report, and conclude with 6 recommendations for donors and development agencies before we get into a more grounded discussion with Neha and Richard. So to start, this research was commissioned by the DCED Women's Economic Empowerment Working Group to better understand how climate change and care responsibilities are intersecting to shape the experiences of women-led MSMEs in low and middle income countries. Because while there is growing evidence of that climate change increases care needs and places additional pressure on households and communities, much less attention has been paid to what these dynamics mean in practice for women's employment, livelihoods, and enterprises. So our research explored how intersecting climate change and care demands are affecting women-led MSMEs, including impacts on things like enterprise operations, income, working conditions, and the health and well-being of women workers. The research also examined the strategies that these enterprises are using to adapt and respond to these challenges, and the role that private sector development actors can play in strengthening their resilience through more care-sensitive and climate-resilient approaches to economic development. I'll just very briefly touch on our research approach, but of course, if you have questions about our methods or our methodology, you are welcome to ask questions during the Q&A period. So our research adopted a mixed methods approach, combining a literature review, an online survey of 23 care economy enterprises across sub-Saharan Africa, Asia, and Latin America, as well as 13 key informant interviews with some of these women-led enterprises, with worker organizations and associations like SEWA and WIEGO, with donors, with researchers, and with other development actors. And I'm just really excited to see a lot of the organizations that we actually spoke with for this research are here in the audience today. And I really welcome your comments and contributions and questions throughout this session. But let's dive into some of the insights and findings that are coming out of this research. So as Martha mentioned, and I think kind of one of the main findings is that this work really reinforces that growing body of evidence that's come out in the last, especially 5 years, that shows that climate change is increasing care needs while simultaneously weakening the very systems, infrastructure, and services that support care provision. So climate-related shocks such as heat waves, droughts, floods, wildfires are increasing the time that households spend securing essentials like food, water, and fuel, having to go further and into more remote areas to collect these things, while also creating additional care responsibilities for family members who may become sick from climate-related illnesses or injured from damage during extreme weather events or displaced because of climate change or who are otherwise affected by climate-related disruptions. And at the same time, climate change is disrupting, as I mentioned, the infrastructure and the services that enable care provision. Extreme weather events can damage roads, health facilities, childcare centers, schools, water systems, energy infrastructure, limiting access to essential services right when they're needed most. So the result is that there's a growing gap between rising care needs and the capacity of care systems to meet them under climate change. And because women and girls continue to perform the majority of unpaid care work globally, they are often expected to absorb these additional care demands when formal care systems come under increasing pressure. And this dynamic has really important implications for women's economic participation, livelihoods, and enterprises. And that's really the entry point for this research, where we're building on kind of existing evidence about the intersection between care and climate to understand what it looks like in the lives of women workers and enterprise owners. So starting with labor force participation, we heard through our survey, through interviews and in the literature, that rising care demands reduce the time, flexibility, mobility, and energy that women can actually devote to paid work and income generating activities. In response, we heard that women may, reduce their working hours, exit the labor force entirely, shift into more flexible forms of work, more often informal forms of work, or just delay business development and growth opportunities as a result of trying to balance rising care demands and complications to paid work under climate change. At the enterprise level, we heard that climate shocks are increasing operating costs for women-led enterprises, disrupting supply chains and supplies, damaging assets and equipment, increasing worker absenteeism, partly due to rising care demands when women who work within these enterprises have to step back from their work to look after family members. This also impacts the enterprises that they work for, ultimately reducing productivity and earnings. And so these pressures really affect overall women's economic well-being and resilience as they face rising income instability, rising debt, asset depletion, and the reduced capacity to adapt and recover from future climate shocks. Our survey findings with care enterprises really reinforce this picture. We heard that 90% of the enterprises that we surveyed reported that climate change is already affecting their operations. Half reported increased operating costs, while nearly half reported supply chain disruptions, higher staff absenteeism. More than 1/3 also reported damage to workplace facilities, equipment, or other assets as a result of extreme weather events or climate-related disruptions. So this really confirms that these dynamics are not just theoretical or abstract. Climate change and care-related impacts are already affecting women-led enterprises today. But importantly, these impacts are not experienced equally. So women-led MSMEs face overlapping physical, social, and institutional vulnerabilities that shape their ability to adapt and recover. First is physical vulnerabilities. So women tend to be concentrated in really climate-sensitive sectors and occupation, sectors like agriculture, market trading, waste picking, care services, or home-based work. And they often work in environments with greater exposure to things like heat, flooding, water insecurity, and inadequate infrastructure. At the same time, women are exposed to unique social vulnerabilities. So unequal care responsibilities and gender norms, as I mentioned, reduce the time, mobility, and resources that women actually have available for adaptation and enterprise development. They also have less access to climate change information and adaptation training, which could help them to understand better and prepare better for climate shocks. And third, women face specific institutional vulnerabilities. They have greater barriers to accessing finance, insurance, and social protection. They also have limited voice and representation in climate and economic decision-making spaces. As a result, women are more often exposed to climate and care-related risks while having fewer resources and information to respond. Particularly, this is true for women operating in the informal economy with limited access to social protection, insurance, recovery financing, and other forms of institutional support. But our interviews and survey findings also show that women-led MSMEs are already adapting. However, they're doing so largely on their own. So at the individual level, we heard that women and enterprises or women are adjusting their work schedules, reducing their working hours, drawing down on savings and loans, sometimes relying on family and community support networks to help take care of children, or in some cases, bringing their children to work with them when alternative care arrangements are unavailable. At the enterprise level, we heard that enterprises are introducing flexible work arrangements to support workers' own care responsibilities, diversifying suppliers to reduce climate-related disruptions in supply chains, investing in climate-resilient infrastructure and technology, so things like backup generators or solar lamps. We also heard them strengthening emergency preparedness measures and training to protect workers and maintain operations. And collectively, women-led MSMEs are working through cooperatives, worker organizations, and informal networks to do things like share climate information, establish early warning systems for climate and environmental events, and invest in shared adaptation solutions. And these kinds of collective approaches are actually particularly important for informal workers and for smaller enterprises. So for example, from our research, we learned that HomeNet Thailand has been helping workers distribute practical heat health guidance through its peer networks. Or in India, Sewa's Mahila Housing Trust has been supporting women's collectives to implement rainwater harvesting systems that improve water security for households and home-based enterprises while reducing the time that women spend collecting water during droughts. But what I think is really particularly striking is that many of the adaptation measures and strategies that we heard are being self-financed, they're largely informal, and they're often reactive to climate events. So while they may help women and women-led enterprises manage immediate challenges, they can also deplete their savings, increase their debt, and they often take a physical and mental toll. So the challenge is not really that enterprises are not adapting. It's not lack of adaptation. It's that many women-led MSMEs are adapting without the external support that they need in order to build lasting resilience. And once again, our survey findings really reinforce this point. So nearly 3/4 of surveyed enterprises had already implemented at least one climate adaptation measure, and there's examples of what that looks like here. Yet, despite these efforts, 64% still report being only slightly prepared or not prepared at all to cope with climate shocks. So ultimately, what we heard is that women-led MSMEs, they need more than resilience, they need support. Across interviews, survey responses, enterprises consistently identified three kind of broad categories of support needs. First was financial support. This includes things like flexible long-term financing, catalytic capital, and loans to enable enterprises to invest in climate adaptation, climate resilient infrastructure, and new technologies. We heard they need technical assistance focused on things like business development services and support, mentorship, and support to develop climate adaptation plans and practices for their businesses, as well as access to climate information and better early warning systems. Finally, we heard more broadly about the need for stronger enabling environments, things like better social protection systems, more investment in public care services and infrastructure, greater representation of women-led MSMEs in national climate decision-making processes and spaces. So there's a need for coordinated action across governments, donors, and financial institutions. Otherwise, women-led MSMEs are going to continue to bear a disproportionate share of the costs and risks associated with care and climate adaptation. And I just want to highlight that the report includes 5 different case studies from different countries around the world that really kind of bring these findings to life through real-world examples. Together, they illustrate how climate and care-related pressures are affecting women workers and women-led enterprises across different sectors, while highlighting the innovative ways that they're responding to these challenges. They also underscore what I think is a really central message of this report. It's that women are not only being affected by climate change, they're also active adaptation actors within their households, communities, and economies. And you'll hear more directly about these realities when you hear from Neha and Richard after this presentation. So finally, the report concludes with recommendations to support the economic empowerment and resilience of women-led MSMEs by addressing some of these key gendered, structural, financial, and policy barriers. So the recommendations in the report are directed to several different stakeholder groups. We have recommendations for governments and for investors and development finance institutions. But today I want to focus specifically on what it is that donors and development agencies can do. And we offer 6 recommendations in the report. First, increased investment in care as climate and economic infrastructure. So expand financing for childcare, elder care, clean energy, climate resilient workspaces as core climate adaptation strategies that can help to reduce unpaid care labor, protect worker well-being, while also supporting women's economic participation. Second, expand flexible and long-term financing that's really tailored to the realities of women-led MSMEs. So increase access to grants, concessional loans, blended finance, or catalytic capital that supports their adaptation investments and helps to address some of the gendered barriers that they face in relation to things like collateral requirements or limited access to finance. Third, strengthen technical assistance and enterprise support. So expand access to gender-responsive business development services, mentoring, and support for climate adaptation planning for women-led MSMEs. Fourth, and this came through really strongly in the research, there is, I think, an urgent need to work with and support collective adaptation through women-led cooperatives, associations, and employer and worker organizations. So partner with, invest in these organizations to deliver climate information, build adaptive capacity, invest in shared solutions, and ensure that women workers and enterprises are being represented in adaptation planning and decision making. Related to that, champion care within climate policy and financing processes. One of the findings of the report that I didn't dig into today, but that is definitely something you can follow up on if you read the report, is that there is an absence of a care lens within climate policy and financing processes. And there's an urgent need to recognize care as an essential part of climate infrastructure and to support the participation of women-led enterprises, cooperatives, worker organizations in some of these global climate decision-making forums and investment processes and spaces. And finally, fund more research, applied research on the care climate nexus. Something that came through really strongly in doing this research was that the ways that care and climate intersect for women and for enterprises is very sector specific and very region specific. So invest in more research in partnership with these organizations, with these enterprises, with women's cooperatives and associations to better understand how care and climate pressures are affecting women enterprises and inform more targeted policies, financing mechanisms, and enterprise support. So really the central message of this research is simple. Care is not some peripheral social issue. It's essential economic and climate infrastructure that's really needed to support women-led MSMEs. And if climate resilient private sector development wants to be truly inclusive and effective, then care needs to be recognized, financed, and integrated accordingly. And with that, I'll hand things back to Martha and transition to our panel discussion. Thank you.
Thank you, Kate, for that very clear and insightful overview. I mean, one thing that jumped out for me is, all these enterprises, the gendered nature in which the enterprises are being impacted, but they're also not sitting there doing nothing. They are innovating. They are actually taking measures, but these are at their own expense in a way and not supported. So how do we support and strengthen those local innovations and take them to scale is something that hopefully we will come back to during the discussion. So I'll now like to bring us into the panel conversation to reflect on how this global picture that you painted for us shows up in the lived realities of women in the global South. So Neha, I will start with you. Your organization works with informal workers who make up the majority of the workforce and enterprise landscape, right? In many of the contexts which we work with, and oftentimes as much as 80, 90%. So this is incredibly significant. So from your perspective, how are care climate-related shocks and stresses affecting the livelihoods and care responsibilities and the well-being of the women that you work with?
Okay. Thank you for that really important question. And yeah, it was really exciting to listen to the findings of the report as well. I'll just begin with a little context, adding to what you've just said. In India, 99% of agricultural employment and 82% of non-agricultural employment is informal. And in self-employed, women make up 23% of this informal workforce, completely lacking income security and social protection. And as was mentioned at the introduction, at Seva, we organize these workers into collective enterprises such as cooperatives, and it's a core strategy to build economic empowerment and also assist informal workers to transition out of informality. So the geographies we work in, we are located in the Western Indian state of Gujarat, and we are experiencing higher frequency and intensity of heat waves, as well as flooding, excessive and unseasonal rainfall. And just to answer your questions, I'll share insights from a few exploratory studies that we have done to understand how climate stresses are impacting both workers as well as the enterprises. Our health wing right now is also partnering with the National Institute of Occupational Health, studying 400 indoor and outdoor workers across agriculture, street vending, construction, and home-based work. So preliminary findings indicate that outdoor workers experience an average of 6 to 7 hours of daily exposure without access to shade, rest periods, or cooling spaces. Home-based workers, including handicraft artisans, often live in low-income settlements in homes that are roughly 10 by 5 feet homes with tin roofs, and their homes double up as workspaces, and they lack access to cooling, ventilation, cold drinking water, and even access to toilets. In fact, we found instances of maladaptation where home-based workers were actively reducing their water intake just to avoid walking to a public toilet in the heat. So overall, excess heat leads to significant productivity losses, and studies have also shown they project a 2% loss in productivity for every degree rise above 25 degrees centigrade of indoor temperature. So these factors, as was also highlighted in the earlier presentation, contribute to lost livelihoods and incomes. 65% of the surveyed workers reported income losses due to illness and reduced productivity. Workers in our study, also already have an average income as low as 3,000 rupees or $31 a month. And for workers who rely on piece rate work or daily wage roles, lower output directly reduces their earnings. In fact, across heat waves and unseasonal rainfall climate risk, we see a spike in household indebtedness driven by the lost livelihoods, livestock health issues, and out-of-pocket expenditure. So climate stressors, both at individual worker level as well as at an enterprise level, they disrupt operations. And for instance, handicraft work, which is highly seasonal, the summer actually sees a spike in customer orders. However, we find that these small cooperative businesses struggle to manage this increased workload due to heat-induced drops in productivity, absenteeism, and of course the expanding care responsibility, which lead to delay in orders as well as working capital stress. Health impacts are also substantial, and this is important because it has a direct bearing on women's care responsibilities. So 40% of our rural workers and 33% of urban workers report high blood pressure, dizziness, nosebleeds, and dehydration. For older workers, heat actually compounds pre-existing conditions like diabetes and hypertension, frequently leading to hospitalizations. And heat exposure also exacerbates occupational hazards. So agriculture workers, for instance, face heat stress along with chemical pesticide exposure that can cause skin rashes and respiratory problems, while handicraft workers experienced heightened eye strain and musculoskeletal disorders from maintaining a static position in rooms with low light. We also see critical trends in reproductive health. So, high ambient temperatures are linked to increased risks in miscarriages, placental complications, and also preterm deliveries. Maternal anemia, notably, is higher in high heat vulnerable districts at 59% compared to 49% in low vulnerability areas. And finally, studies that we have assisted in, which have happened in our work areas, also show an increase in domestic and sexual violence against women in heat stress areas, and this is driven by combined mental and financial strain because of the loss of livelihoods and growing debt. So when family members or when women themselves fall ill, they manage this expanded care responsibility with limited or no support in their homes, and they also face rising expenditure when their own earning capacity is reduced. Lastly, I'll also add that during peak summer months, school closures means women lose institutional support entirely, forcing them to manage childcare during the hottest months of the year. So in the absence of full day childcare, maternal support, care for the elderly, as well as patient care, women lose time to work, earn, rest, or also build their own adaptive capacities against climate stressors.
Thank you, Neha, for that very vivid painting us a very vivid picture of how the majority of people in the global South who work in these informal spaces are experiencing this firsthand. Richard, let me turn to you next. Your organization, AgWatch, focuses on providing accessible elder care services in contexts where these are limited or unavailable, but at the same time, those that are providing the services are also the majority women who are the primary caregiver in their own homes. So this is like a double whammy, so to speak. How is your work and the people who are providing the care being impacted by climate change? And is this something you are seeing as a growing issue or not?
Thank you so much, Manta, for that question. You have rightly put it out, but allow me to reiterate that as AgWatch Africa Foundation, we are in this panel discussion because we focus on older persons, caregivers, women workers, and vulnerable householders affected by poverty, irregular inequality, and climate vulnerability, as well as weak social protection systems. And as the research has already brought out, climate change is not only an environmental issue, it is actually also a care economy issue. It's a gender issue. It's a livelihoods issue. Why? Because as you rightly said, women bear a disproportionately higher burden because they are both economic factors or actors in unpaid care systems and also within their households. So into your question, how are they affected by the shocks and stresses of climate action? In various ways. Climate-related shocks, they are increasing the unpaid care burden on women. And how is this happening? Because during droughts, floods, and during food insecurity and disease outbreaks, women spend more time sourcing water, caring for sick family members, and supporting older persons and maintaining households under very, very difficult conditions. Number two, women are experiencing what we can call time poverty. Time poverty. Why? Because many women engaged in informal work, caregiving, agricultural work, and cooperative works are working longer hours due to responsibilities at both workplaces and back in their domestic settings. And thirdly, old women caregivers are especially affected in many households. Older women, grandmothers, are primary caregivers for grandchildren, some of them often vulnerable children, sick relatives, or even displaced family members. Climate stress worsens economic insecurity, while increasing dependency on them for care. That's a huge impact. Climate action is also affecting livelihoods. In what way? Because it disrupts directly the income systems. Reduced agricultural productivity, loss of income, and food insecurity, all this reduce household ability to pay for childcare, to elder care, transport, healthcare, or hired support. And care responsibility is equally affected in that there's a strong but often overlooked nexus between climate vulnerability and a care economy. When climate impacts increase household stress, the demand for care rises sharply without proportionate increase in care, infrastructure, and support. And that occurrence, that care infrastructure and support systems remain weak under such circumstances. The overall well-being of women, the mental and psychosocial impacts are significant. Women report stress, anxiety, exhaustion, and emotional strain from balancing caregiving work, income-generating initiatives, and climate survival strategies. The private sector is also affected. In markets, farms, and informal enterprises, all these become less productive when care burdens intensify. Climate shocks, therefore, affect labor participation, productivity, and economic resistance or resilience across community. So to close up this question, Martha, if you permit me, this will be my summing statement for that question. That climate change is silently expanding the care economy without proportionate expansion support for the women who sustain it.
Thank you, Richard. That's also another example of how you are seeing it on the ground, play out in the ground. So I want to pick up on something that Kate mentioned in terms of the, how these women and their organizations are building resilience. And I want to come back to you from where you're sitting. What are some of the ways, I'll start with you, Neha. What are some of the ways that women workers and cooperative members are adopting to the climate care nexus challenges? And how is your organization supporting them? So if you can tell us briefly, that would be great.
So we have learned that climate adaptation means looking at women's work and livelihoods holistically, especially to understand the income and time losses. So this begins with always direct consultation with the women, analyzing their entire workday, and to understand exactly where they need support to make their work easier, free up their time, and also offset or stop or offset income losses. So as was mentioned, workers are already adapting organically. So agriculture workers, for instance, have shifted work timings to cooler parts of the day. Street vendors are using larger umbrellas. Home-based workers, we find, are covering windows with wet grass as a passive cooling technique. So our role has really been to document these emerging needs as well and practices, as well as to co-create solutions and bring in technical support where required. So I'll share a few examples. So the first is a parametric insurance product for excess heat and rainfall that triggers payouts based on a specific threshold. This was co-created with workers by Seva's Insurance Cooperative, and we've piloted it with an InsurTech partner. It aims to provide a financial cushion when extreme weather disrupts daily earnings. And these products, of course, are still work in progress, but based on workers' feedback in the first round of piloting, specifically on care burdens, when a family member falls ill, we also updated the design in the second phase to offer the insurance not just to workers, but also their spouses. So this is one example. A second initiative is the adoption of clean energy technology, specifically biogas plants. So these were actually initially introduced to save agricultural input costs and generate high quality natural fertilizer, because farmers had shown interest in shifting to low chemical farming to improve soil health. But what this has also done is enabled a shift from traditional smoke-heavy chulas, as we call them. They're basically fireplace or hearths, to biogas stoves. And this has been an important core benefit, as it gives women access to clean cooking fuel, and also drastically reduces the time spent on cooking as well as foraging for firewood. And this access to low-cost fuel has actually been a source of resilience during the current global fuel crisis, and that actually it has really expanded demand for more and more farmers want to install biogas plants. Third, as an enterprise support system, we focus on strengthening market linkages and diversifying sources of income without increasing women's drudgery. So for agriculture workers, for instance, this means cultivating hardy, water-efficient crops like millets and mushrooms, and helping with market linkages for this, alongside also building productive assets like poultry and goat rearing. Fourth, we link workers with age-appropriate social security. So this includes publicly available schemes for health insurance, pensions, as well as creches that are run by women-led cooperative enterprise that we have promoted. So these creches operate from 10 a.m. to 6 p.m. and they offer services to children aged 6 months to 6 years. They provide age-appropriate nutrition and also focus on education and cognitive development. And the women who use these services report having dedicated time and the mental space to really focus on their livelihoods. Our health cooperative also runs awareness campaigns on managing heat and monsoon-related illness, in addition to other women worker-centric health issues. It also runs low-cost chemist shops in low-income settlements, which facilitate access to affordable medicine, ORS, as well as menstrual hygiene products. And what we are seeing now is also cooperation between these women-led enterprises. For example, the leadership of our handicraft cooperative has decided to disseminate the same key messages that they receive from the health cooperative to the artisans associated with their cooperative via WhatsApp. And they're also kind of some adaptive measures that they've taken up are experiments with simple, low-cost temperature and humidity sensors that trigger alarms. And this is intended at nudging workers to take up preventive action earlier, because with heat, what we find across workers is it's highly normalized, because they can't see it like a flood or like unseasonal rain. We're also experimenting with cooling jackets that keep areas near the neck, the chest, liver, diaphragm, and torso area. These jackets reduce body temperature by 6 to 8 degrees. And lastly, this is the last point, at a system level, we are working to integrate grassroots perspective into macro policy. So in Ahmedabad in India, we operate within the context of one of the world's first municipal heat action plans. And while the action plan is primarily designed on preventing heat-related mortality, they largely ignore working conditions and gendered risks for informal women workers. So through the sustained policy dialogue, we hope that these realities are also explicitly taken up in urban climate planning. Yeah.
Thank you, Neha. And I will pose the same question to Richard. If you can briefly tell us how your organization or the women that are working adapting to these challenges.
Thanks again, Martha. The adaptation strategies among women workers are very deliberate and very specific. Number one, women are creating community-based coping systems. For instance, they are coming up with village savings and loans associations to be able to strengthen their economic capacity. They are also diversifying livelihoods by becoming essential entrepreneurs in the community. Women are increasingly combining small-scale farming, informal trade, caregiving, and cooperative participation all to be able to stabilize capacity. Intergenerational support is playing a key role as well, in that older women, for instance, are providing care to younger women who are still employed, and they are able to go back to work and carry on with their work, while the older ones are providing the needed care to look after their young children. And community-led care models are emerging organically in some communities. Women are rotating caregiving responsibilities or organizing collective support during climate emergencies and peak labor seasons. That is helping the women to cope. Technology is equally helping. How? Because climate information systems, mobile savings platforms, digital health information, and climate smart livelihood approaches, all these can strengthen resilience of women. And in this part of the world, yes, they are taking full advantage of that provision as well. How is our organization supporting these initiatives, these efforts? Support resilience through capacity strengthening and social inclusion approaches. I'll mention just a few. These include caregiving for social protection and older persons' rights, strengthening community support systems, facilitating access to information and services, and promoting inclusion of older women in climate and development discussions. Again, as a parting shot for this question, this would be my summary statement, that women are not waiting passively for solutions. They are already innovating and adapting. However, they need systems that recognize, reduce, and redistribute unpaid care work.
Thank you. Well said, Richard. And I had one last question, but I also want to go to the questions that participants have posed. I know some of them are being answered already. So there is one question that I would draw attention to, Neha. There's a question from Kimberly. Question is, given your experience with women workers, can you speak to the increase in violence that women experience due to either the loss of male family members' work due to climate change, or the need to seek extra work to make up the loss of income by working in more dangerous situation? So if you can elaborate on sort of the gender-based violence aspect.
So what I will talk about is we see increased migration of men, and there is then an increased feminization of the agricultural, and because I'm talking about agriculture in specific, agricultural workforce. Of course, the need to seek extra work. We haven't seen situations of women getting into more dangerous situations, but yes, there has been anecdotal evidence of women getting into prostitution, for instance, because of indebtedness. But this is not something that we have documented. It is things that we've heard from our cooperative members. So like I said, it's anecdotal evidence. Yeah, I'll stop here. And if there are some more, more specific questions, we can take that up.
Thank you. Then I know many of the questions posed have been answered online, but there was one that touched on sort of my last question. So I'll pose it, and I will also invite Kate as well to weigh into this. So looking ahead, what type of investment or support are most needed to help women better cope with both climate and care challenges, and to support organizations like yours and others who are working in this space? I'm sure there's a long list that you have, and Kate has also mentioned some, but if you had to choose just one or two priorities, what would they be? Let me ask, okay, so Richard can start us off, and then I will go to Neha and Kate.
Thank you, Martha. And this is a very important question, because the support that women need can never be overemphasized. in Africa and most Global South platforms, they are doing incredible work with absolutely limited resources. So the issue of support is really, really important. And so the care economy must recognize as essential in infrastructure. Its investment should be supporting the following areas: community child care systems, health care services, respite care for caregivers, access to social services such as water and energy, access to healthcare and social protection systems. All that infrastructure should get the needed support, and that will lift the efforts that the women are putting forth. Secondly, we need policies that reduce and redistribute unpaid care work. Climate adaptation policies, they rarely interfere, rather integrate care responsibilities. Yet women's unpaid care labor is subsidizing entire economies and communities. That should be acknowledged. That should be accepted. Social protection systems, these must become climate responsive. In what way? Cash transfers, health insurance, pension systems, and emergency support mechanisms. All these should recognize caregiving roles and climate vulnerability. The aspect of data cannot be forgotten in this. Data and evidence are still limited, especially in the Global South. More research is therefore needed on this. The economic value, for instance, the following areas deserve research: economic value of unpaid care work, climate impacts on caregivers, older women's roles in resilience, care economy losses linked to climate shocks. All these are areas that deserve research. And so to the women, the support is, we can say it is late, but it's not too late. It is time that every stakeholder should be able to recognize what the women are doing and start supporting them in those specific, tangible ways. And for organizations like ours, the private sector has a major role to play. Employers, cooperatives, agribusiness, and local enterprises, all these can support. They can support in flexible work management, family-friendly workplaces, social protection contributions, workplace child care initiatives, health and psychosocial support for workers. We can also invest in local institutions and community organizations. Like Edward Africa, we are trusted to care after or to look after older persons. Connection between our work and the younger generation who are working offsite and looking after their folks is important. So for me, as a closing point to this question, if we ignore the care economy, our climate responses will remain incomplete. Women are holding together households, communities, and local economies under immense pressure. Strengthening resilience means investing not only in infrastructure and finance, but also in people, in care systems, in social protection, and community solidarity.
Thank you, Richard. Neha, the same question.
Great. So I think, yes, a lot of what we recommend also resonates with what Richard has said and also what was shared in Kate's presentation. But we need to treat evidence, care, infrastructure, and enterprise support as interconnected components of climate adaptation that can build resilience for both workers and women-led enterprises. So first, just reiterating the need for investing in evidence. We need occupation-specific research for both indoor and outdoor workers and how workers are impacted by climate stress. And our collaboration, which I mentioned with the National Institute of Occupational Health, it's a government-led institution, but it demonstrates how partnerships between organizations that have a grassroots presence, along with government or technical institutions, can serve as a way of developing a systems level baseline based on which contextual climate solutions can be co-created. Second, we need an investment in full-time childcare, which directly frees up women's time and also protects their income during crises. At the same time, we also need to invest in understanding age-appropriate care needs across the life cycle. So, for instance, in India, formal geriatric care is still nascent. And moving forward, solutions for elderly care and maternal support will be essential to address women's care burdens. We also recommend investing in social enterprise models, including cooperatives to support care needs. As was highlighted, these institutions build on women's existing knowledge and skills, and they also they also support workers to transition out of informality while also delivering essential services. So, scaling and replicating these institutions requires investment in supported enterprise support systems. And as was mentioned in the initial presentation, that includes access to working capital, incubation support, capacity building, and mentoring support. And of course, we need improved investment in physical infrastructure. So for outdoor workers, this means providing shade, clean toilets, water, safe first and last mile transport facilities to ensure women workers' mobility is not impacted during extreme weather events. Also, for home-based workers, priority needs to be given to upgradation of incremental upgradation of their homes, focusing on passive cooling and ventilation, and elevating structures that are in flood-prone areas. And a lot of this work is also done by the Mahila Housing Trust that you mentioned in your presentation. And this would also involve documenting traditional knowledge on conserving water and really keeping spaces cool, because these are local practices based on contextual knowledge. So what needs to be done to sort of standardize or see what it takes to sort of replicate this knowledge? Yeah.
Thank you, Neha. So I'm going to give the floor to Kate for maybe I'll give you 1 minute to add. A lot has been said already. You've already mentioned if there's anything that came out from the case studies that were not presented in detail here that kind of would add to what was said in the conversation. It would be great to hear. And as you are preparing for that, there is a really nice note from Anna that would actually, it was a good wrap up. I'll come back to it later, but let's hear from Kate first.
Thanks, Martha. Yeah, I mean, Richard and Neha, you said everything that I was thinking, but I will just say the number one kind of support need that came out of our survey and from interviews was enterprise level investment in kind of the needs that enterprises themselves know to be important to the work that they do. So depending on the sector and the region and the specific type of climate impact and the specific way that plays out in women's lives and affects their care responsibilities, you know, it really is so specific. So listening to enterprises themselves about the kinds of what they want to do with that investment. And then lastly, I would say voice and representation. So ensuring inclusion of women's enterprises and worker associations and cooperatives in developing private sector development programs and investments in participating in local and national climate adaptation planning, things like that, like the need for additional inclusion and voice and representation came through a lot in what we heard from women themselves. Thanks, Martha.
Thank you, Kate. So in closing, I'm going to refer to the two comments, questions that came in. One from Anna. I think that would be a really a thought to take us through as we depart. Question is, you know, about redistributing roles between women and men. How would businesses feel or react if their male workers were not able to come to work as they needed to stay home to look after children, the elderly, or general household care? What would the response be different than what we are experiencing? And I think that's a good food for thought to leave with. I don't think we can respond, but I think this is something that we need to interrogate and challenge ourselves, but also like the ecosystem. There's also a note or a question, but I take it as a suggestion from Hilda, basically acknowledging that, yes, more evidence is needed, particularly from the Global South, but what would be, as we set a research agenda, because there are just so many things that are now on the table, what would be the 2-3 questions that must be answered to influence the care and climate infrastructure as we move forward? And that's something actually for all of us collectively to think through. And IDRC in particular we are at the core of funding research for development, applied research. Those are some of the things that we and others who are working in the space need to reflect on. What would help to move the needle? And I think those are good reminders. So with that, we've had a very rich conversation. I'm sure we can continue if we had more time, but everything has an end, so we will end here. But I just want to thank everybody, first of all, DCED for investing in this, for providing this platform and space, for the panelists. I know this is eating into your evening, and Neha, this is your very late in the evening for really joining us. All the participants who have come from different places and for engaging with us, thank you very much. So the report will, as I mentioned, would come out at the end of June. We will make sure that it's circulated with those that have been registered, and it will be published on the DCED website as well. Keep an eye out. We will also share the recording. So with that, I wish you all a good evening, afternoons, and let's continue this conversation. Thank you.